Welcome to Grand Rounds at the UCSF Osher Center for Integrative Health. My name is Shelley Adler, and I have the pleasure of serving as director for the Osher Center. Today, I am absolutely delighted to be introducing Dr. Scarlet Soriano. Dr. Soriano is the executive director of Duke Health and Wellbeing, where she leads a multidisciplinary team to address gaps in healthcare delivery structures through health and well-being interventions that are grounded in health equity. She's a member of the board of directors of the Academy of Integrative Health and Medicine and a founding member of its Black, Indigenous, and People of Color Committee. She was memorably co-chair of the Academic Consortium for Integrative Medicine and Health's 2023 Symposium that took place in February. And you can't see that behind my mask, I am smiling because Dr. Soriano was so compelling that she got us all to go to Chicago in February. Her work focuses on designing healthcare delivery structures that create conditions for deep personal transformation through self-efficacy and positive change-making, which lead to both individual healing and community transformation. In her consulting work, Dr. Soriano supports organizations in rethinking healthcare strategies through the lens of equity and whole person community health. She's also passionate about planetary health and wellness-based group medical visits. So you can see both in terms of Dr. Soriano's experience and expertise that her work is very inspiring to me and many of us at the Osher Center and aligns so beautifully with our integrative health equity mission. Some quick housekeeping. After the presentation, we'll have about 15 minutes for discussion. Please submit your questions to me directly by way of the chat feature. You can do that at any time through the presentation. And then afterwards, you can also pose questions directly. So let me know if you want to go on video towards the end. And lastly, I want to thank our fabulous Grand Rounds Planning Committee, Doctors Selena Chan, Anand Dhruva, Patty Moran, and the fabulous Jen Shea, Yvette Coulter, and Julia Burns. So now please join me in welcoming the wonderful Dr. Soriano.
Thank you so much, Dr. Adler. It is such an honor to be in your presence. You are a giant in my mind, and to really be sojourning together and certainly following on your footsteps and the footsteps of so many who are doing beautiful work and beautiful service to support positive transformation in many different ways. We are all deeply needed in this process. And I am just honored to be with everyone who's here and inviting all of us, if we can, maybe even before I share my slides, I'm just going to invite us all to take just one or two breaths and just coming fully into presence, bringing the mind and the cognitive faculties into or in close proximity of the heart, in whatever way is meaningful to each one of us, creating an intention for inner balance and for rest, perhaps for openness and for generosity of spirit. And with that, just with much gratitude, I would love to begin this this conversation. I have the privilege of speaking a lot longer in this sense, but you'll see that this is a conversation. It's a very conversational and weaving through layers of understanding kind of presentation. And so just wanting to begin, first, no disclosures, and these are the objectives, which hopefully we will accomplish, and ideally the unwritten objectives of, if I were to have a fundamental objective here, it is that all of us who leave this presentation feel a little sparkle, a little bit, a ray of sunshine inside of us, that is invigorating, that is uplifting, and that ignites all of our capacities to think about what else, how else can I be continuing to support positive change in the spaces in which I exist. So I'm hoping that everybody's going to be just a little bit more shiny from the inside out by the end of this presentation, and that all of these other pieces will be wrapped up within that primary purpose. And so I think everybody has been exposed to the idea of equity and as differentiated from equality, and then this sort of further idea of justice. And I love the graphic, which I'm sure everybody's seen, where not only do we appreciate that the current context in which we exist in the United States and across the globe doesn't allow for the highest opportunity for flourishing if we apply a lens of equality, of one same size standing box, and that until systems truly change and the fence is gone, we have to think through the realities in which we exist within the complexity of those realities to create the perceptual, the structural modifications, shifts that will allow all of us to attain the highest level of flourishing. And I think the picture speaks much more clearly than words in many ways. So just wanted to ground us in terms of that, and then thinking about just what an incredible dynamic experience this beingness is. And as we think of ourselves about as change makers within our fields, I think holding and navigating and riding the waves of complexity with an open-hearted, curious, non-shaming perspective can be really helpful in supporting that ignition and that invigorating light that I'm hoping all of us will continue to nurture within ourselves, because there is no easy answer, not only from a structural perspective and all of the multiple layers of change that we need to engage in, but also because we are not automatons. We are in deep, it's life relating to life. And so there are internal factors as well as the complexity of external factors that we are observing and engaging in a dynamic way. In terms of just another fundamental in sort of the beginning of the discussion, more concrete discussion, thinking about what social determinants of health. And one of the ways I think about social determinants of health would perhaps be best, and you can be reading the slide, but this is how I want to make this a little bit more conversational, would perhaps be with a story, and stories will be coming out throughout the presentation. So I remember not long ago being with my auntie, and we were laughing, and we actually had helped my mom move to her apartment, and her sister was there, and we were laughing, and I said, Tia, do you remember when you took a shopping cart and you moved the house, you moved places with the shopping cart? And she was like, oh, I remember, and blah, 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 and we're just talking. And this was life. Now, this was in the 90s in inner city Brooklyn. We were an immigrant family that had arrived in this country in very, overcrowded conditions, living under the poverty line. And when my aunt moved with her family, initially were maybe 10 of us in one apartment, all of us in shared spaces. And when she moved to her place. The only affordable place was a basement apartment. She had two little girls, and she was the littlest one, was almost every weekend in some seasons in the emergency room with asthma attacks, just again and again and again. Nebulizers, everything, both of them had asthma, and the little one, and one physician, I wasn't there, but she tells the story of one doctor saying, look, you either move or you could lose this child. And that was an experience that was so shocking and so profound to this, amazing woman, my aunt. She said, okay. She contacted a friend who was able to let her go actually back to the place where we had moved from. And the lady, the landlord who lived there, and she had no means. My family were making around, I know my mom was making something like $3 an hour in a factory. And she took a shopping cart. She took what she had because she needed to save her child. And so I think that we can read this. We know this. The studies are here. You have a big reference list. That doesn't even begin to touch the amount of data that exists. There's a ton of information. But grounding this on the inner and outer is really important, because on the one hand, we have a system in which a subset of the population is living under tremendous duress, and layer upon layer of challenge sort of mounts to create conditions that lead to differential outcomes. These are the health disparities that we talk about. And then you have the lived experience. Nobody's reading a textbook in the morning and saying, oh, yep, my social determinants are not looking so good today. But you have the lived experience of loving your baby and saying, I have to save her life. And there is a power that cannot be underestimated and that must also be harnessed, that my auntie drew upon when she couldn't draw upon the systems. She drew upon something else. And so as I design, as I think about healthcare transformation, I think, how can we be moving at all layers? How can we be advocating for policy change? How can we be really thinking deeply about whether our spaces are welcoming, whether who's at the table, who's not at the table, what is the burden of access, right? In terms of accessing healthcare services. And then how can we support an ignition of a sense of capacity to become a change maker in this world within all of us, including those we serve, that they are not passive and not powerless. That power is actually incredibly abundant and observed in the sheer act of survival. Hopefully that was long enough that you read the slide and you can see that social determinants account for a good lot of what we consider to be health outcomes. When we think about them, oftentimes we think in terms of some of these terms, housing, which we know is huge in a number of health systems. I know Boston Medical Center, for example, where I worked before Duke, making substantial investment in housing in a number of counties, et cetera, really thinking deeply about housing, because we know, and I put some of the data there for you, we know that the experience of being unhoused is fundamental as a social driver, along with, of course, all of the other pieces that and access to healthy food has become one that, from a health and well-being and integrative health perspective, has been near and dear to my work and my life, and that we'll talk a little bit about in terms of how are we thinking about utilizing some of our resources at Duke now to engage with that inner and outer piece. But you see neighborhood safety, and one of these studies is just looking at the impact of police stops among adolescents, and what does that do to stress levels, the chronic toxic stress, among many others. We know that just a notice of eviction is can produce a lot, and research shows can be a profoundly stressful experience. That feeling of threat, of future insecurity. And then, so we have these pieces, we have sort of these structural pieces, and I'm just sort of laying out a little picture that we all know all too well, thus the conversation and the opportunity for us igniting one another. And then, you know, I have to say that I am a big fan of Dr. Vivek Murthy. I love his capacity to take a place of influence and bring in conversations around things like connectedness and the impact of social isolation, which we're seeing at sort of epidemic levels right now. And these are this is linked to his recent report. But knowing that we have not only economic systems and structures, living conditions that support disparity, but also we have created ways of functioning in the world, a lot of which mediated by our dependency on personal sort of devices in other aspects of our lives, the lack of common space, safe common space, etc., and moving away from that has left us deeply isolated from one another, and also in many ways vulnerable to the mental health duress that can come just from that social driver, from the lack of human connection. We know that a lot is affected. And as I was trying to bring forward in that story from my family, it's a dynamic, you know, it's multi-layered, and it's dynamic. And so as we're thinking, we want to maintain a sense of curious openness and willingness to surf the waves of complexity, because we are talking about life, and we're talking about very changeable, but highly interactive inner and outer realms. I wanted to pause and talk a little bit in terms of the situation in the drivers as I see in the places and opportunities we have. Just wanted to touch on what we all are, I think, deeply aware of, especially with the ACEs study and all that has ensued since, just the profound impact that childhood adversity can have on health outcomes. We know that there is just a significant increase in a variety, including the major ones, of chronic conditions that are linked to the experience of trauma. And as the ACE scores go up, the risk goes up. And I'm sure everybody knows that. But we also know that there are external and internal protective factors that can modulate that not everybody who has had ACEs has the differential health outcomes. And so as we're thinking, as we're engaging in this long-term view about societal change, not just healthcare transformation, but whole society change, I invite myself and all of us to think about, how do I bring in those protective factors as we're pushing for legal change, and as we're creating the other pieces that come together for communities to be able to live in conditions where children can thrive. And just bringing some of that in and putting in a couple of studies, and in particular, I think it was the Logan Green study around even youth that have already entered into probation kind of experiences. We have data to show that having the experience of support, structural support, but also love in action, which you're going to see in a moment, from counseling to other services that allow for a sense of being valued and being seen in a redirection can modulate the trajectory that would otherwise be seen in many children who've experienced some of the greatest duress in our society. So thinking about where are we in terms of, let's bring it back to healthcare, and where are we? What are possibilities? This is a short period of time, and so I have very little here. I am sure sitting virtually among people who have done so much, and I really want to learn from you and think with you together, because there are so many models that exist already where folks are doing everything from, I draw back to BMC, rooftop gardens, to do in food as medicine prescriptions, and engaging health coaches, and engaging communities, and creating linkages, and decentralizing, and welcoming more of the wholeness of a person. So I know that what I have to share is fairly limited, but really excited to hear and learn more with you, and recognize that there's a lot happening. One place where I am biased, because I have had the opportunity to take deep dives into designing shared medical appointments and work with them within the context of a population that is living primarily at or below the poverty line, and historically marginalized in different ways, is shared medical appointments. I think that we already have, if we're sort of starting with where we are and what's happening already, one easy place, one low-hanging fruit that I see for us to think about engaging more of the whole of the person is by pushing for wellness-based delivery systems, such as shared medical appointments, that allow for the conversation, for the awareness of the complexities to happen at the clinical entry point, knowing that we're already downstream, we're already, I don't want to say late, but we're already working with manifestations, but that we continue to push for systems to create these environments in which the thick description of a person's life can come through. We have the ability to actually hear my aunt say, you know what, I'm only making $3 or $4.50 or whatever it was at the time an hour, or $15 an hour right now, and I can't afford movers, or I don't have, if I take a day off work, I may lose my job, so I'm not doing this, and there is a way in which there is an opportunity to simply listen and understand at the level of the healthcare system writ large, if we were to embed well-designed shared medical appointments that allowed for more of the fullness of a person's life to enter the clinical encounter, and of course pair them with opportunities for accessing available resources, or within the health system and also outside of the health system. One of the ways in which we did this at Boston Medical was there were navigators that were on call, present, and warm handoffs could happen that could support a person who needed socks, who needed whatever it might be in the moment, so that it wasn't just a referral in a computer. And so thinking about, and a lot of this may come up when you actually have the time to unpack, but creating robust referral systems that then link to a more shared horizontal clinical experience can be one place, one way in which equity can begin to enter more robustly. And I want to tell you one more story, because this is one of the ways, and there's so many, but one of the ways in which I was profoundly shifted. When I was designing group medical visits at Boston Medical Center, where one of them was working with people who had experienced cancer, who were cancer thrivers. And it was about supporting well-being. And there was a gentleman there who had profound transformations during the experience. He was able to allow himself to fully experience, and became open to a lot of new tools for autonomic self-regulation and for lifestyle change, and also became a teacher, became a big teacher to many, and brought in, moringa from, which he had used in the islands in his family. I often mention he just became this very beloved part of the shared medical group experience. And one day towards the end of the experience, he came in and he was really like, ready to talk. And he said, I have to tell you all what happened to me. Well, and so I'll retell the story a little bit, but not necessarily from as he would say it, just because I can't do it. But he was a great cook. He was living in shared housing because he was again living under the poverty line. He was a Black man. He had experienced deep trauma in his life. He loved to cook, and he was in his room. And he had made a pot of stew, and the stew was kind of simmering in the common kitchen. And he heard something happening in the kitchen, walked out of his room and found another man who lived in the house, taking a spoon, sticking it in his pot of stew, and then eating from it, and then putting the thing back into the pot of soup. And he's telling us the story, and he said, and I did this. I just like looking at him and saying, what are you doing? And he said, what are you doing, man? Why are you holding your hands like that? And he said, I'm doing this so I don't kill you. And we laughed, and I was again forever changed, because these were acupuncture points. This was acupressure. This was one of our energy practitioner who was embedded in the group, was teaching different acupuncture-based acupressure techniques for autonomic self-regulation during times of stress. And when we think about the triggers that lead to the loss of a life, when we think about the ways in which a person's experience can bring them into a state of dysregulation or of sympathetic overdrive that can tip the brain into amygdala-driven limbic system reactivity, something as simple as that was integrated. He was bringing it into the nobody's watching lived experience of my life when I'm not in a clinical encounter, and using it to change an outcome. And so I bring that because I think that if we can harness that, if we can support that integration, this was his, and he could use it, and he didn't kill the man, and he could laugh about it, then we know we are contributing towards an honoring of the possibilities that exist within us as we make the larger change, the larger structural change. They're equally large in my mind, but as we make the external policy and structural change. And I just want to speak also about hope. I have found this to be in my own life and in working with amazing people moving through disparity, and that when we build our clinical services through a strengths-based approach, through an approach that kindles and that calls forward as well, and that harnesses hope, there is that ignition that can happen, that can support that integration, that can allow for the energy. For me, to me, hope is an energy that allows a person to say, I'm going to do this instead of that. I'm going to do, I'm going to engage in this way. I'm going to become active in that way. I'm going to see it in this way instead of this way. And we can design through it. We can bring it, not just our kind of ROI formulas, which are really important for sustaining the structures in which we deliver care and which I value. But are we designing so that there are opportunities for people to feel hope and exposure to conditions that can ignite hope? And we know, and just I was not able to take a deep dive into this literature in particular, but we know that there's actually, and I put in some of the studies here, we know that there are sort of key components that we can use to actually design with, this sort of goal orientation and attainability of goals and ability to create a plan around a goal. So there are ways in which we can recognize this and embed it into how we think about how we deliver care and harness the inner power that can lead to outer transformation of lifestyle choices, but also of community engagement in our own impact as a person in our communities, and then potentially feeding back into health systems themselves. A lot of some of this literature is on pain as in the ways in which group medical visits that build this aspect of hope can support well-being. So just wanting to highlight that. And to me, all of this is code. I needed to get the permission to bring in that 4-letter word that is the fundamental, in my mind, unity that exists. That and I am quick to define it. And that first bullet point is my definition of what I call love. Unconditional regard. A disposition to uphold the inherent value of the life in front of me, regardless of all of the letters behind their name, the lack of letters behind their name, the anger in their voice, the love in their voice, that despite what I'm observing, there is a fundamental expression of life that needs no validation, that it already is. And I think that if we've historically engaged this with universal human rights and with our attempts to undo paradigms that devalued and continue to devalue life. If we design from this place, if we think about health systems being able to engage with those that they serve and those they employ and those they're made up of and those they connect with through unconditional regard, how would we change the ways in which we deliver care? It's calling for what is well and speaking into what is well and harnessing from what is well in order to engage what may be out of balance right now in my life, as a person seeking care, or as a person experiencing a health challenge, or as a person wanting to thrive more in my life. That is immediately followed by self-worth. The fact that, and so I'm sharing with you the design principles that go into how I build. I have found in my experience that when we are able to make change from a place of meaning and purpose, from a place of being worthy of expressing the highest potential that exists within each and every one of us, that that way of engaging with myself, of making whatever changes might be, whether they're in my life or in my work in the world, is very different than if I am being driven by the fear of a particular health outcome or a particular consequence. And it ties in to that inherent value in unconditional regard. I'm going to, this is like perfectly timed. I did not time him, but the last piece that I wanted to bring in, that's sort of one of the key foundational ingredients in my design soup and ways in which I engage with system redesign, is joy. And I laugh because if you are really keenly listening, you might hear some snoring behind me. That's my dog who's behind me and is snoring away. And I think that's just a perfect, universe intervention, that there's got to be lightness to what we do. That no matter the despair and disparity and challenge we face, there has to be room for bringing joy and cultivating humor and laughter and connection that uplifts the mind and the heart as we think about healthcare delivery structures. Celebration can really transform, and we know, that we are flooded with a lot of good oxytocin and other good biochemistry when we engage this. The way that this all comes together for me in terms of igniting change makers in our own patients, in ourselves, is what I've come to term empowered hope. That there's a way in which tapping into my own strengths, tapping into my own inherent value, feeling safe and unconditionally regarded, and supported with additional tools, experiences, expressions, and being given the ability to share and give of myself, can lead to a sense of well-being that is both active, self-efficacious, and uplifting. I'm not being driven by fear. I'm being driven by worth. I'm being driven by possibility. Yogi tea bags, I just love them. This comes from one of them. And I think that, we started with bringing the mind into the heart. I think there is a profound power that exists within all of us across all kinds of differences. This place of regard, of caring, of connection that can be harnessed to support change making that uplifts ourselves and others. I know I only have a couple of minutes, so I wanted to just super fast mention a couple of programs. I wanted to, I won't be able to take a deep dive into this, but one place that was really profound for me was Zuni Youth Enrichment Program. I have no financial relationships to them. They're in my mind as a real beacon, and I invite you to take a look at their website. I lived in Zuni and worked at Zuni Hospital for some years, more than 10 years ago. And ZYEP was just beginning. It was begun through our then medical director and then a number of community leaders, and has flourished. But this is one example in which community and hospital clinical settings have collaborated in a very much actually moving things out of the hospital and creating everything from trail systems in this exquisite land, the Zuni land, which is a very sacred land, that are trail systems and community gardens, and ways in which intergenerational knowledge can be woven into food sovereignty, understandings and new structures, and reclaiming nutrition, reclaiming the traditional and very deeply rooted running that can also support ways of stemming the diabetes epidemic that is over our country. So I wanted to give you just a couple of examples of ways in which we can use our creativity to harness possibility. And a key piece here is decentralization and its local community leadership, and is thinking upstream and celebration. And I just want to end by speaking a little bit into one of the things that we're doing at Duke. We are in the early design process for a program that is going to have multiple pieces around food sovereignty. And I'll be actually, for those of you that might be seeing the Food as Medicine Global Conference that's going to start tomorrow, we did a spot for that as well. So you'll hear this twice, but we are starting this Healthy Food, Healthy Life program that is going to have a first part that addresses supply, that is going to work with a subset of families and towards all of this, towards informing policy and provide real world access to healthy foods through a variety of mechanisms and a delivery system. So there'll be home delivered produce, and pair it with a teaching kitchen based culinary celebration, very culturally grounded, and paired with longitudinal health coaching, and paired with advocacy and involvement and opportunities to engage with local food advocates and chefs, and being very culturally and socioeconomically contextualized. And as you can see, these other pieces, and then we're sort of bridging in terms of speaking the language that often drives some of the structural change. We're partnering with the Duke Microbiome Center to look at what happens to the microbiome of participating families, as well as other markers of health, and present to our system, to the county, to others, the impact that this kind of experience can have in terms of health outcomes of importance, and also the feasibility of doing this at a larger scale. I want to just also mention, for sort of end on the fact that we're at a critical moment. I'm sure many of you saw, and I've put in a link to the recent report by the National Academy of Medicine around whole health, which the VA sort of pioneered and weaves in a lot of integrative modalities and other components. But there's been a call to the nation, to Congress, to actually to scale, to really expand integrative whole health, well-being approaches to healthcare. And I think if we think about healthcare transformation, we have a unique historical moment right now that we would do well to engage with and to advocate for, and to do whatever we can to capitalize on and bring in principles such as the ones that I've shared with you, if they resonate for you, and the ones that you yourself consider to be critical, so that we're active in this conversation, and so that what emerges from this is able to honor the complexity, the power, the empowered hope that exists within all of us, and the change-making capacity that exists within all of us. Because if we do that, we can see things, actually, they're tipping points, and we can see things shift fairly quickly. So we come back to love, and I put in the link to the video, which is very beautiful. And so this is my last slide. I just ask you and myself, how will I, both innovatively, holistically, and also lovingly, through this sense of unconditional regard, engage with structural drivers and social determinants of health? Thank you so much for letting me be part of this with you. I'm going to stop sharing and turn it back to you, Michelle.
Thank you so much. I mentioned how inspiring I find you, and I feel that every talk that I have the pleasure of hearing and learning from you feels like a healing experience as well, which is not always the case with grand rounds or other presentations. So I'm going to invite people to turn on their videos if they have a question for you or a comment, and I will start the transition, if that's okay, with noting a couple of things. First of all, I really appreciated in your discussion early on of social determinants of health, incorporating story. And I think that in all areas of integrative health, maybe particularly in research, some of the statistical information sort of masquerades as understanding. It's critically important to have that, but the stories and the ways you described at the beginning, we can bring our hearts and brains or minds closer together. I think it's something that's so critical and it's often missing. So I just wanted to note that I really appreciate not only your a brilliant conceptualization of the destination that we want to arrive at, but also the journey and the ways to find joy in what can be a real struggle along that journey. So thank you to your snoozing dog as well.
Thank you. And I will just say, if I may, that I find that when we actually live our lives and we look at the communities we serve, that this is what's happening. And it's like we have to actually, the data becomes our server, but it can't be exactly as you said, it can't be the only understanding, because things are being lived. And if we keep the lived and we observe the lived and we see people laugh in the middle of things and we weave that into how we design, then I think we can invite more of the whole person and the whole community.
Yes, absolutely. So the first question is, do you see that there are unique roles for integrative health in addressing health justice and in rectifying a lot of the injustices? So as opposed to sort of health equity efforts in general, coming from integrative health, what does that bring in a unique or different way?
Yes, I think we are uniquely suited to be at the center of the conversation because of the explicit desire to address the whole person, because mind, body, spirit, and community are foundational to integrative health. So I believe very much that we really hold a critical key to the paradigm creation that could, the creation of new paradigms that could drive forward a new set of structures in which, of course, of course, we address everybody, how you're eating and how you're moving and how safe it is to move, because that's how we think. So, but if we're at that table, if we are at those sort of, we have opportunity to influence what the future of healthcare looks like, then I think we can ensure that the whole person and community are there. So we're needed.
Thank you. I appreciate that answer very much personally. Another question has to do with group medical visits, and again, your engagement with stories. I know we both have a background in medical anthropology also, but the question has to do with any healing effects that you see in terms of shared storytelling in the group medical visits.
Absolutely. It's very interesting though, because one of the things that I have experienced is that when we first harness strength, and when we first are able to bring possibility, the way in which storytelling happens shifts, almost as if the language, the symbols that we draw from are shifted so that there is less of a tendency to storytell in a way that perpetuates the experience of disempowerment. There's a way in which one can call for strength that can, if I may just give a super fast example.
Please.
One person who was, I've had mentors that have been profoundly inspirational for me, and one is a man named Ken Ginsberg. He's a pediatrician at the Children's Hospital of Philadelphia, and was somebody who I worked with as a student at the Covenant House in Philadelphia, which is a shelter for unhoused youth. And I remember being a second-year medical student, and so it was like, oh my God, I'm going into kind of clinical experience and going to Covenant House with him. I was already interested in this kind of work, and we were sitting outside on the curb with a young lady. And actually, I think we were I don't remember if we were sitting or standing, but she was 14, 15 years old. And she was very agitated. And she was saying, you know that guy over there, that's my pimp, and he's checking me out, and I can't go into the clinic. And she had been, homeless, unhoused, and had left home, and was just, Ken asked her a couple of questions, and she was speaking about this. And she wanted, she was afraid to go in and get the service that she needed. And when she paused, the first words that came out of Dr. Ginsberg's mouth were, wow, you mean to tell me that when you had left your house and your little brother was still there and you were worried about him, you went up and you climbed up the fire escape to check on him and make sure that he was still okay? You are amazing. You're an incredible person. To this day, so many decades later, that was another moment. That young woman's eyes lit up and she said, yes, I did. And she was present. She was present. So that's what I mean about when we intentionally bring the strength forward, there's a way in which there's a calling out of what's already there that might not even be visible to ourselves, and becomes visible and then can be harnessed.
Thank you so much. It's so beautiful. I want to invite Dr. Kavita Mishra, who is our Director of Clinical Programs, to ask a question. Kavita.
Hi, Dr. Soriano. That was just a beautiful, beautiful talk. So many pieces that I'd love to connect with you on. The quick question I have is around food as medicine. I love the concept of teaching kitchens, and recently heard it flipped as a learning kitchen at actually one of our other Osher centers. And I really liked that flip of focus. And I'm curious how that resonates for you in terms of how we think about these kitchens.
I love it. I hadn't experienced that, but I like that idea. We could even call it an exchanging kitchen, because the learning goes in all directions. But thank you for bringing that into my awareness. Thank you. I love that. And I think it's great to play with all of this.
Yeah, the University of Wisconsin at Madison, their Osher Center did that, and never thought of it that way. And all of a sudden it was like, oh yes, of course. That's right.
That's why these conversations are so critical, because each one of us can take something and a light go off, and then all of us really benefit. I love that concept. I think we're going to change it. Maybe we'll make it an exchange kitchen and make sure that it's bi-directional.
Some new signage. Well, we're unfortunately at the end of our time now. I want to thank you so much. Again, the healing effects, the inspiration of your presentation are very strongly felt. And as we are in our 25th year as a UCSF Osher Center, focusing now, I know it's been a while, on integrative health equity. I feel like you've really helped us locally do some aligning as well. So thank you so much again. You are an inspiration, and look forward to staying in touch in many different ways. So let's join in some virtual applause. And again, thank you so much for joining us.
Thank you so much for the opportunity and for